Hi, you are in the ladies' room with Dr. Donica, the only public ladies' room you can enter anytime without ever waiting online. I'm your host, Dr. Donica Moore. We'll be having real conversations with real women about really intimate issues. They may be embarrassing, sad, or funny, but they will always be interesting and informative. You know, like the best conversations you've had in ladies' rooms with your best friends, or total strangers and a physician. Please join us. Hello, and welcome to another exciting episode of In the Ladies' Room with Dr. Donica. You are going to love my next guest because we are talking about a new trend taking over plastic surgery, and it's about getting prettier and sexier down there. Now, some people are euphemistically calling these procedures vaginal rejuvenation, and some are calling it a designer vagina. But women are flocking to get what's medically called labiaplasty, a surgical procedure in which the appearance of the skin around the vaginal opening is reshaped. In fact, according to statistics from the American Society for Aesthetic Plastic Surgery, or ASAPS, the number of women undergoing these procedures has increased by 200% since 2012. And that in the past year alone, they've increased by 11%. Now, why are so many women unhappy with what their labia look like? Many women also want vaginal tightening without a surgical procedure. There are also several options for them, one of which is Votiva, which has sponsored our guest, Dr. Jennifer Berman, today. This is an in-office procedure that may be beneficial in the treatment of sexual dysfunction or as an adjunct to Kegel exercises in order to tighten the pelvic floor muscles, to increase muscle tone, and rejuvenate the vaginal mucosa and increase lubrication. You're going to hear much more about this from Dr. Berman. Now, we previously talked about the use of women's health physical therapy or physiotherapy as a modality for these same issues with Heba Shahib of thepelvicexpert.com from Sydney, Australia, in episode number 34, which we called, Is It Bad to Hold Your Pee? And Other Questions Which Send Women Running to the Ladies' Room. This is because one of the consequences of weak pelvic floor muscles is stress urinary incontinence. So who better for us to talk about this with than a woman urologist? So our guest, Dr. Jennifer Berman, is not just a urologist and sexual health expert, but she's a former co-host of the Emmy award-winning show, The Doctors. You've seen her on just about every daytime television show. She's also the sister and former television co-host of our previous guest, Dr. Laura Berman, who we spoke with in episode 14 about changing sexpectations as we age. And just for fun, we aired that episode. We first aired it on Valentine's Day. Of course, all of our episodes are archived on iTunes, and you can you can binge listen to them. You could binge watch them on our YouTube channel, or you can tune in when you have a specific interest or need, or you just have some downtime driving in the car. Anyway, so we aired that one on Valentine's Day. Together, the doctors, I like calling them the Doctor Sisters Berman, co-hosted a national television program called Berman and Berman on Discovery Health in 2002 to 2003. But you've also seen her on Good Morning America, the Oprah Winfrey Show, the Today Show, CNN, CNBC, HLN, and the Dr. Oz Show, and probably others I can't even remember. Now, just to give you some background about her credentials, Dr. Jennifer Berman earned her undergraduate degree in psychology from Hollins College in Virginia. She then earned a Master of Science degree at the University of Maryland and went on to receive her medical degree from Boston University School of Medicine. After that, she went back to the University of Maryland to complete her postgraduate urology residency and then did a fellowship training at UCLA Medical Center for Female Urology and Female Pelvic Floor Reconstructive Surgery. So she knows what she is talking about. In 2001, she co-founded and served as director of the Female Sexual Medicine Center at UCLA and was also an assistant professor of urology. She is the co-author of 2 books with her sister. One is called For Women Only, which fully covers female sexual dysfunction. And then 4 years later, Secrets of a Sexually Satisfied Woman. That one should have come first, in my opinion. But we're going to have her come back another time to talk about that topic. And of course, when Dr. Jennifer Berman and I were chatting before our segment, we came up with like 17 other topics that we need to talk about. So she will be back. Dr. Berman is the winner of several awards, including the Women Who Make a Difference Award, the Rising Star of the Year Award, and the Women of Action Award. And she's also a mom of 2 teenage children. Another fun fact, Dr. Laura Berman and Dr. Jennifer Berman are not the first sister pairs to be guests on separate episodes of our podcast in the Ladies' Room. We've also had the pleasure of talking with sisters Sally Schwartz Higginson in episode 10, where we talked about losing your virginity after divorce, and Betsy Schwartz Brint in episode 12, where we talked about tweaking the teens, making the decision to have cosmetic surgery before you can vote. And teaser alert, we have another dynamic dual physician sister pair coming up into upcoming episodes. But without further ado, please help me welcome Dr. Jennifer Berman into the Ladies' Room, where we're going to talk about all about designer vaginas, how to get one, what the costs and risks are, and why anyone would want one in the first place. Welcome, Dr. Jennifer Berman, into the Ladies' Room. Thank you so much for joining us.
Thank you. Thank you for having me.
We are looking forward to this. My listeners are dying to hear all about the designer vagina. Now, I live in an area where women are always talking about their designer bags and their designer clothes, and they're always looking for the latest, greatest new thing. But when Newsweek called this the designer, listen to me, my Brooklyn is coming out. The designer vagina, we had to talk to you and find out what's going on, who would need this. Obviously, they were talking about surgical procedures and labiaplasties. So why don't you start there and explain what is a labiaplasty and why would anyone want one?
Well, I mean, we're all familiar with cosmetic surgery, right? The things that we can do to our breasts, to our butts, to our abdomens, to the fat in our arms, to the wrinkles in our face. And, and I'm a proponent for women feeling the best that they can feel and to make the changes that make them feel beautiful and comfortable. And I always have been. My sister, who's a sex therapist, differs slightly, in her opinions than I do, but I've always been a proponent for women, optimizing their best selves.
Yeah, and we had your sister as a guest on this show. She was our Valentine Day guest. Yes.
She is? Well, good. That's a great topic.
Yeah. We talked about sexpectations as you age, or changing sexpectations. And as I said in the intro, you are not the first sister pair that we've had in different episodes on the Ladies' Room. And ironically, one of the other sisters we had was talking about plastic surgery in teenagers. So now we're talking.
Oh, really?
Yes. And actually, labiaplasty is not uncommon in teenagers. For teenagers who have one labia or one side that's much greater in size.
Right. Well, it's one thing if there's a congenital issue, if there's anatomic asymmetry that is causing, shame or embarrassment in a teenage child, like in the locker room around her friends. And in those circumstances, it can be functional as well as cosmetic. But just let's, starting with the general population, we accept cosmetic surgery all over our bodies. We don't judge that. We're aware of that. And now in this, now that we're moving into this phase of advances in modern technology and surgical practices, issues and concerns pertaining to the way how things look down there are also concerning to women. Now, the question is, why are they concerned with the changes, and what's determining normal? What are they looking at and saying, I want mine to look like that? Or mine doesn't look like that, it needs to look like hers. And unfortunately, what's interesting, and this is a part of my research right now, there is no conventional norm. In cosmetic surgery, there's a program of symmetry. The eyes need to be here, the shape of the face. So plastic surgeons know exactly what is considered beautifully and aesthetically attractive, and they try to aim for that ideal. In terms of the genitals, we don't have those norms yet. So what women are basing beauty on is media ideals. And by media, I mean porn and
that kind of media.
The erotic imagery that young boys see. So the challenge that I have for that is, women and young girls trying to appear like ideals that aren't necessarily normal.
And that aren't necessarily real. They could be photoshopped.
Photoshopped.
But in your experience, are women asking to look like somebody else's photo, or are they asking to look like they did when they were 20 years younger?
So it's twofold. There's the desire to appear. Now you're talking about older women. So in older women, that's a no-brainer. They want to look more youthful. Okay, so as women age and the texture and the quality of the skin changes, the collagen and elastin below the skin levels deflate and changes. So the same sagginess that occur in our breasts and our face and our arms and our knees is also occurring in the labia majora, the outside labia, and the inner labia, inner lips become more pendulous, so droopy and floppy. They sometimes take pendulous, and they also become a slightly darker color. They're more blue brown than pink, pink. And the internal lips and the outer lips deflate, become droopy, saggy, and appear older as an aging women, and women want to look more youthful. So I can understand that, and these modalities we're going to talk about today can help women obtain a more youthful appearing external vulvar area. Now, in terms of
the other issue in terms of droopiness and sagginess is the laxity of the vaginal walls and the laxity of the pelvic floor muscle.
Well, I haven't gotten to the inside yet.
Okay,
we're just talking about cosmetic, purely cosmetic. And
I like to go right to the good part.
But going back to your question was what are they thinking is normal? So an aging genital area, we can imagine what that, even if we're not aging yet, for your viewers, is what that may appear like, and what that may, how you would want to return to the way you were. Now, the other thing that you mentioned is, are women saying, I want to look like this porn star or that? And the answer to that is yes. Girls, young women and young girls are saying, they call it the Barbie, which is basically in my opinion, as a woman and as a mother and as a doctor, is a very infantile, not infant, but prepubescent sort of look, which to me
also
is
androgynous,
disturbing. Androgynous or immature, almost childlike, which is disturbing to me. But that sort of kind of immature, childlike look is appealing to some women, some cultures, so there's a Barbie type labiaplasty, which basically involves removing of the excess redundant tissue. And the other issue I have with that is that the labia, there's a reason we have labia, and the labia sort of help to protect the internal entry, but it also functions to grab, it's erectile tissue. The labia contain vascular erectile tissue that encircle the shaft of the penis. So during intercourse, it gives more length actually to the vagina and adds to pleasure for both the man and the woman. So when we're amputating erectile sexual tissue, to me as a sex educator and pioneer, my head starts, no! But so I just want, I think it's important we're having this conversation. So yes, it may look different or may look better, or maybe you're achieving this ideal, but you're cutting off, sexual tissue in so doing. So the labiaplasties involve surgery. So it involves anesthesia, it involves cutting, it involves sutures. It requires in my opinion, as a surgeon, as a urologist, a board certified, trained aesthetic surgeon who knows how to do these procedures. They look really simple on paper. If you open up a book, or look at, it looks like, okay, all you do is you line this up and cut that off. It's really not. These procedures are technical and do require skill, practice, experience, and it is a surgical procedure. So
how much recuperation time?
It depends on what is done. So the labiaplasties can also involve clitoral hood reductions, which is where if there's excess skin on top of the clitoris, women want that lifted as well. So it looks like the same.
It looks like the video is slowing down.
So
I'm wondering if there's a problem with the.
So it could be mine. I'm going to scream really loud. Please don't mind. I'm going to say, Claire.
I need a Claire in my life.
I need a Claire. I'm going to have her open the door. Can you keep Here's Claire. Can you keep the door open, because the internet is they're having problems with the internet.
Oh.
Or move the modem over a little. All right, so removal of erectile tissue to get the more youthful look. It depends if it involves a clitoral hood reduction. That's a more extensive surgery, and usually that's about at least, you know, the genital area heals very quickly, assuming that there's not an infection, but it also swells up quickly. And sometimes I've seen complications where the wound dehisces, which means it separates if it's put under too much tension. Again, which is why I really emphasize that if somebody is undergoing one of these procedures, that they vet their surgeon very well. So there's swelling, there's pain, there can be infection. So usually 4 to 6 weeks before, you know, you're back in the saddle again, so to speak.
Right, that's the biggest complication to me, is it puts you out of commission for 6 weeks.
Yeah. And then, you know, the price of beauty, some would argue, but, you know, all of these things need to be weighed, the risks and the benefits, when you're considering any surgical procedure, much less one that involves your genital area. And I have seen women that have had complications with infection, separation of the wound, asymmetry, or where an inexperienced surgeon in this area kind of just chopped off and thought they could just sew it up, and then the aesthetics of that are not good. But so moving on to the brighter side.
How many women still want this procedure after you refer to it as an amputation of their labia?
Well, by the time, I don't tell, okay, your labia, I personally do not do the cosmetic labiaplasties. I've been trained. I'm a urologist. I was trained in pediatric urology as well. So that's microsurgery, and there's a lot of aesthetics pertaining to that, and I've been trained and I've taken courses and observed, but I don't do them because you have to really be doing a lot of them, and I, you know, my practice isn't set up to do that. So I, even being trained, know enough, or at least for me to feel comfortable to be doing these procedures. So I don't tell women that they're, you know, I'm not talking to them pre-op, but they usually come to me for a second opinion, or to understand more, or after there's been a complication. Now, that said, there are some beautiful results. There are plastic surgeons here in Los Angeles, New York, all around the United States that are extremely well trained, and that have, you know, pioneered these procedures and perfected the procedures, and have, you know, really, you know, been able to help women that do have asymmetry, and women that do have issues where the labia are interfering with them wearing yoga pants, or them having sex, or that they can see when they're wearing tight clothing, that you can see like the bulging areas. So, you know, there is an indication for these.
That's the camel toe.
The camel toe, or even just, you know, asymmetry. It's more on one side than the other, or that the lips are going inside, or that the seam of underwear or thongs are kind of constricting and causing discomfort. But, you know, the good news is, what's so exciting to me is there are minimally invasive non-surgical procedures that don't require anesthesia, that don't have downtime, that you really can't get botched from, that offer not necessarily the same as a surgical result, but pretty darn close as far as I'm concerned. Well, today, there is a device, at least in my opinion, called Votiva. All of them claim to reduce and shrink the size of the internal labia. The Thermiva, the Divas, the Votivas, all of them sort of, you know, make those claims that it helps with the outside appearance. In my opinion, there are two. There's one called Diva, which is a fractional laser that has an external component of a laser, and also a fractional laser for shrinking of the outside labia. The Votiva which is radiofrequency heat, also has a microneedling component for the outside, for the external labia, the labia majora, and the labia minora, the internal labia. And this is, and I'm very excited about this technology, because from the aesthetic side, we're going to talk about function and laxity and lubrication in a minute, but just purely on how it looks, this Votiva technology, has been pretty outstanding in terms of the change in the appearance of the inner labia. The color, remember I said it gets darker, kind of blue hued, the color becoming more pink and youthful, the deflation and the sagginess becoming, lifting slightly, becoming more tighter, the change in the collagen. So I've been really pleased with the results, the aesthetic results of using Votiva on the outside. And then for the inside, we can talk about why.
Yeah, let's talk about the inside, because I think that's really important to a lot of women. We had a woman physical therapist from Australia who came to talk to us about pelvic floor laxity and pelvic floor muscles and the use of physical therapy. So we've kind of covered that end of it, and this would be kind of the next step, right?
Right. Well, this is, after you've pushed, 2 9-pound, 8-ounce babies out of your vagina, which is what and somebody tells you, oh, do Kegel exercises. It's like telling a 90-year-old woman, go lift that barbell. It's like, am I doing it? So the pelvic floor muscles, as well as the support tissue, the ligaments and tendons supporting the pelvic organs, get stretched, denervated, and damaged due to carrying a baby to term, delivering babies, as well as aging and menopause. So that's been my big, obstacle is do Kegels, but if you can't really do Kegels or you don't have the muscles to do Kegels, you can't do Kegels.
Right. And my feeling about Kegels is they're best done preventively, long before you have a problem.
Yes. So you're right. And
nobody is motivated to do them when they're 20.
When you don't have the problem. Yes. Although, what's changing a little bit now with these millennials who are very open and forward thinking about sexuality and sexual response and pleasure, there is now enough data confirming that the pelvic floor strength and pelvic floor tone helps to improve sexual arousal, pleasure, sexual performance, and so on. So they're doing it for those reasons, if nothing else, not necessarily.
And they have apps to follow it and to motivate you to learn how to do it properly. Yeah. So that's great. Games. But so incontinence is one of the big consequences of pelvic floor muscle weakening, and that, of course, is right in your wheelhouse.
Of aging, menopause, and having babies. So these modalities that utilize these minimally invasive vaginal rejuvenation treatments that utilize radiofrequency heat as well as laser or light are functioning to resurface the vagina, so to improve lubrication and sensation, which occurs with aging and menopause, to help restore the elasticity of the vagina, meaning its stretchiness. As we get older, it either sort of relaxes and becomes lax, or in some older women that are menopausal that don't take hormones and or that have had a hysterectomy, it can become constricted and fibrotic and tight in a bad way. Mm-hmm. And, women are saying, I want to be tighter, but there's tight as in this kind of tight that it stretches and goes back, like rubber band tight, or like scar tight. We don't want scar tight because scar tight is avascular and scar tight hurts. Right. So these treatments using radiofrequency heat, such as in the Votiva or the form of V, helps to restore and resurface the lining of the vagina, which helps with lubrication sensation, prevents urinary tract infections and yeast infections, restoring the ecosystem of the vagina, and then also helps with restore the connective tissue, elastin within the submucosal, below the surface layers, which allows for the stretchiness. So it gives the feeling of restoring of the youthful, healthy tightness, not the scar tightness, as well as a reproductive age woman lubrication and vaginal discharge, like back to when we were in our 20s and 30s. So that's what's so exciting about this. Now, in terms of incontinence, which also occurs with aging, menopause, and babies, these modalities based in, small clinical trials, they don't have this indication yet. None of them have an indication for treatment of stress urinary incontinence, but all of them have anecdotal reports and preliminary clinical studies showing that they do improve symptoms of mild to moderate stress urinary incontinence and urge incontinence, for that matter, which is leakage of urine when you cough, laugh, sneeze, and or associated with vulvovaginal atrophy, frequency, urgency, or leakage of urine, when you're putting the key in the door or when you're running up the stairs, that type of incontinence.
Right, that sense that you're just not going to make it there.
Can't make it, and the little squeezes out. Right.
That whole, like, I got to get there.
Exactly.
So that's awesome. And of course, anecdotal evidence for people who are listening is just, this is what patients tell us. We don't really have, large scale clinical trials or data, but I never argue with something somebody tells me worked for them. Now, what is the process that somebody goes through? What's involved with this? How many times do they have to go? How long a procedure is it?
The other good news about it is that you don't need to undergo a full pre-op, getting your blood drawn and your EKG. They're all pretty much designed so you can't really do harm. That in many of these procedures, and depending on the state that you're in, medical assistants can do them, nurses can do them. The doctors aren't even doing the procedure, which I'm not necessarily in agreement with. In my office, I do all of these cases myself because each woman is different. Each woman's anatomy is different. Each woman's symptoms are different. Some women want more sensation. Some women are having difficulties achieving orgasm, so you have to focus more on the nerves here. Any number of things. So it's important, I think, being a medical doctor to be able to vary the treatments. But all of them require a series, or most all requires a series of 3 treatments, 4 to 6 weeks apart. So you do 1, 2, and 3. And then that has shown in the clinical trials for each of the companies to be the most effective in terms of obtaining the result and maintaining the result. Many women will experience improvement and change after one treatment, and they'll be like, oh, wow, and may not be motivated to come back in. And eventually they do, because it's not sustainable after just one treatment. You really need 3. And
then after the third treatment, it's sustainable for how long? Ish.
It depends on the age of the woman, the hormonal status of the woman, whether she's on or off HRT, whether she's menopausal, the extent of the damage, but generally 6 to 8 months. This isn't permanent, as is a facelift isn't permanent. They say in 5 to 7 years, usually another one. This, 6 to 8 months, a year. And then then we call, what I do, at least in my practice, I call them boosters. They'll come back within 6 months to a year, if needed, to have a treatment. So you don't have to undergo all 3 again, but here and there as needed. I've had all of them because I actually do try, and everything that I'm prescribing for my patients, I am a menopausal woman myself, that as independent, I've tried all of the medications, all the hormones, all of these treatments, and I have the symptoms. I have stress incursions, I have frequency, urgency, dry, everything they have, I have. And for me and my body, my DNA, whatever, it's about 6 months. My time frame is 6 months. But as I said, I pushed 2 huge babies out, and and I'm small. I'm smaller build. So 6 to 8 months is typical.
Yeah. See, I had vaginal bypass surgery for my children. And so one of the best things having had C-sections is I have this amazing bladder, and, knock wood, even at my age, I have no vaginal symptoms, which is
lucky girl.
Yes. But that's from, that's from C-sections. Yeah. So, we've talked about, as far as a risk factor, birthing big babies and being a small frame. But what are other risk factors that would cause women to have issues?
With urinary control?
With vaginal tone, with pelvic floor weakness, muscle weakness?
Well, aging, menopause, and babies, even carrying a baby to term. I know you didn't deliver it vaginally, but carrying a baby to term, full term, affects the support structures to the pelvic floor. So they do become, lax. Maybe the vagina itself is intact, and you don't have widening of the introitus, or the support for the bladder and urethra is intact, but there still is, some changes. And then in women that have any type of neurological issue or condition that affects muscle strength, muscle tone, or muscle contractility, can experience changes in vaginal sensation, vaginal elasticity, and vaginal tone. And then there's something that we're talking about low tone, but there's also conditions of the, that cause too much tone. And, but that's a different story. The other thing that I failed to mention that these treatments are great for, although not indicated and FDA approved, is for vulvar vestibular pain, such as vulvodynia, as well as lichen sclerosis. And there's actually, I think there's at least two papers published in peer-reviewed journals pertaining to the use of laser vaginal rejuvenation with the laser to treat lichen sclerosis.
And is it the
that's
same
great
procedure,
too, because
or do you do it differently when the patients are coming?
It's the same. Well, there's slightly different settings, but the same technology, the same procedure, the same device, and and so that's great, because lichen sclerosis is a really debilitating condition. The treatments don't really work. They're long, they involve steroids. Vulvodynia even worse, because vulvodynia flares up and comes away, and that's pain. Although lichen sclerosis is pain too, but vulvodynia affects younger women also. Lichen sclerosis is typically more older women. Not that makes it any better, but some of them are not sexually active anymore. But yet, vulvodynia, which is inflammation, irritation, and pain in the opening of the genital area, which they believe is typically nerve inflammation of the small nerve fibers, that is a real challenge. And, people have gone so far as Botox injections, vestibulectomy, removal. We talked about amputating genital tissue, removal of part of the internal labia, the vestibular glands in the labia, which is a surgical procedure. So this technology is amazing. So how is it working? How is laser, light, or radio frequency working to improve pain? And the premise is that it's these technologies cause neo-neuro, which means new nerve regrowth. So it's eliminating the bad inflamed nerves and causing new nerves. So, we talk about plasticity in the brain, how nerves can regenerate and regrow. That's what's happening in the vulvar area in terms of women even without vulvodynia, that they report enhanced sensation, enhanced feeling. And the women with vulvodynia that are having bad sensation, bad feeling, it helps to restore normal.
So I wonder if this can enhance sensation in women who don't have any problems.
Well, then I've thought about that too. Our brains think alike. And, if you don't have any I guess, I don't know the answer to that, but it makes me nervous because, the whole Adderall craze about
right, and that's exactly what I was thinking of. Exactly what I was thinking of.
And the enemy of good is better. However, some women who may think that they're normal don't know. You don't know what it. If you're wearing, like me, my glasses are always foggy and smudgy, and when somebody takes them off and cleans them, I'm like, wow, that's what the world looks like. So it could be in some
when I got my car washed last week. I seriously thought my vision was getting worse because I wear different glasses for driving.
Yeah.
And yet once I got the car washed, all of a sudden I could see so much better.
Exactly.
So how long does each one of these? How long does each one of these procedures take? What's the time commitment?
They're really quick. Like the Diva is about 11 minutes. Mm-hmm. So the lasers are quick. The ones that utilize radio frequency heat, such as Thermiva and Votiva, those require a little bit more time, roughly 30 minutes internally. Mm-hmm. And then I do about 10 minutes on the outside around the dorsal nerve of the clitoris, the posterior labial nerves, the periurethral nerves. So about 10 minutes there just for the radio frequency heat. So 30 minutes total. And then on the outside, that's about 5 to 10 minutes. So 40 minutes for a full Votiva internal and outside.
So it's like a lunchtime makeover.
Yes. And then you're back, you go back. The thing, there is some downtime, meaning that that you can't have any vaginal penetration for at least 5 days, or and you have to be careful about the outside, that you're not wearing tight clothing or pantyhose or causing friction on the outside. But they're extremely well tolerated, little to no pain afterwards. There's some itching, burning, a little bit of irritation occasionally.
Is there any medication involved, pre-medication or post-medication? There's
no medication required afterwards, except if you want to take Advil. But But pre-procedure for the Votiva with the microneedling on the outside, we use a topical numbing cream inside and out, which makes it comfortable, tolerable. Women say it feels like a rubber band, like you're going snap, snap, slightly on the inside. But you like snap, 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 and then but that's with the Diva, the laser. On the with the heat modality, it's like a warm wand on the inside. So sometimes patients will say, "Oh, that feels too hot," and we can adjust the temperature. But you don't need numbing for any of the radio frequency heat treatments. It's the lasers that are a little bit uncomfortable. But the topical numbing medicines work great.
Great. And then, of course, the most important question is, what does this cost?
Well, it depends on the doctor. It depends on the state.
So
the problem is that they're not covered by insurance yet. So the patients do need to pay out of pocket. Most all doctors do provide a super bill with the CPT and ICD-9 codes to submit to your insurance. In my experience, they're not getting covered yet, even though Votiva is FDA approved, the only one that's FDA approved for the condition of sexual dysfunction or sexual function complaints. So the cost ranges depending between $900 to $1,000 up to $1,300
per session, or for the total, or for the three?
No, per session. And then some of the treatment, like for instance, the Votiva and the Diva, the Thermiva, there's consumable products like the probes, there's grounding pads, there's different, so that is bundled into the cost. If there's numbing medicine required, the doctors put that in, add that in. So there is hello? Can you
just keep talking. We'll work with it. I think the internet connection is a little slow.
Probably
all the way from California
to New Jersey. But that's, so they're not, inexpensive, but we talk about the cost of beauty, and it's I've been super pleased with the results. I think that these issues do need to become a priority for women. Optimizing sexual wellness, sexual sensation, sexual function, vaginal function and response needs to be a priority. We don't make it a priority.
Well, that's why we talk about it all the time in the ladies' room. And I think this is just one more thing that women need to know about as an option. That if this is something that's a concern for them, they can talk to their doctor and find out if this is something that's good for them. Anyway, I know you're on a tight time frame, so I just want to wrap it up by asking my favorite question that I ask everybody in the ladies' room. Aside from this interview, what was your most unique, interesting, or memorable experience that you ever had in a ladies' room?
In a ladies' room, so you had to add that.
I thought your sister's response, by the way.
I
don't even try.
What was hers? Tell me hers.
She, of course, of all people, she came up with a story about how she was in a ladies' room and a couple was having sex in the next stall.
Wow.
That never happened to me.
I would say the ladies' room issues were. It's funny, I thought you were going to say, what's the most interesting experience? But you added in the ladies' room. What comes right to my mind, literally, and it's not necessarily a funny thing or a good thing, but it was a thought-provoking thing, so much so that we even covered the topic on the doctors, was having my son in the ladies' room when he would come in there with me up until about the age of 6 or 7. And that was extremely offensive to some women. And I just took it totally for granted. Like, this is a child, he's in here. I don't want to leave him in the airport while I come in here by himself, where I'm a mom, have some compassion for me. I can't bring him in the stall with my suitcase and my bags and him and pee in front of him. That would be, a little bit worse. So that what's appropriate, that was interesting for me, and parenting, the way that women approach parenting and the judgment that other women have.
It's amazing. And I started a hashtag on Twitter because of the whole transgender bathroom bill thing. And I started a hashtag, we have stalls. In my entire 57 years of using public ladies' rooms, I have never, ever, ever seen another woman's genitalia or another female's genitalia unless I was changing her diaper. And that was one person.
But is it?
It's unbelievable.
I thought about that too. And I don't know if it's the issue of seeing, it's the issue of, we are in there doing our private things. Like there's still taboo about bodily functions. We pee and nobody knows it. So the fact that
nobody knows that's why we went into that room in the first place.
So the fact that somebody from the opposite sex that we wouldn't allow into our little space, is knowing that we pee. I think that's what's disturbing about it, that we could be washing our hands next to somebody that is of the opposite sex. However, here in LA, FYI, many of the bathrooms are co-ed.
And that's starting to become a thing here too.
Totally. And there's there's one restaurant where there's a central, like you could see going in, and like there's like it's like
the
almost
central
station. Yes.
Yeah.
And I even me, as progressive and open as I am, it's, with grown men and me, like my brain's like, I was like, wait, it took me a second to kind of, okay, to reframe. So we're programmed, from birth that,
although if you think about it, if you grew up living with a father or a brother, or in my case, 4 brothers, you shared bathrooms.
So you're used to it. So how do you fit? So it's no big deal to you.
What? Yeah, we all did that growing up. I actually ran into I was in an airport last week, and a guy accidentally came into the ladies' room, and he was mortified. And I said to him, what are you doing my poster?
He's Instagramming, and I'm
awesome. Tag me. I'm at Dr. Donica Moore. Anyway, he was mortified. And I said, look, you didn't see anything. Nobody was doing anything that you wouldn't see out in the airport other than just washing their hands.
Yes.
And maybe you saw somebody put on lipstick, but that was it. So yes, true confessions. We put on lipstick in the ladies' room. But we love these stories. And this is why we started this podcast. And we welcome men to listen, because of all those men who've been saying for decades, what do you talk about in the ladies' room for so long? What takes you so long in there? And now they know. Anyway, thank you so much for joining us and for educating us, and come back anytime.
Thank you. I enjoyed it.
Take care.
Bye.
That's all we have time for today. But let's keep the conversation going on Twitter or Facebook at Dr. Donica. And please join us next week for another episode of In the Ladies' Room with Dr. Donica. Real conversations with real women about really intimate topics.